Hey everybody, it's Enjoy Everybody. Today we're diving deep into a topic that's close to all of us, abdominal pain. We've all felt it, that discomfort, that ache, that sometimes sharp, sudden pain in our stomach. But what does it all mean? Abdominal pain is incredibly common and can be caused by a whole bunch of things. It can be as simple as indigestion from that extra slice of pizza, or as serious as a condition requiring immediate medical attention. That's why it's so important to understand what's going on in your body. So whether you're experiencing a dull ache or a sharp stabbing pain, stick around. We're going to break down the different types of abdominal pain, explore their causes, and discuss when it's crucial to seek medical help. Let's get started. Let's talk about acute abdominal pain. This is the kind of pain that hits you suddenly and intensely. It's like a wake-up call from your body saying, hey, something's not right. And you know what? Your body's usually right. Acute abdominal pain often signals a medical emergency. Think of it like this. Your abdomen houses a bunch of vital organs, all working together in a delicate balance. When something disrupts that balance, like an inflamed appendix, appendicitis, a blockage in your intestines, bowel obstruction, or even a tear in your stomach lining, perforated ulcer, you're going to feel it and it's not going to be pleasant. The pain might be sharp and stabbing, or it could feel like a cramping sensation that just won't quit. You might even experience other symptoms like nausea, vomiting, fever, or blood in your stool or vomit. These are all red flags, guys, and they shouldn't be ignored. Now I know what you're thinking. Dr. Mike, every time I have a stomachache, do I need to rush to the ER? And the answer is not necessarily. But if you're experiencing sudden, severe abdominal pain, especially if it's accompanied by those other symptoms I mentioned, it's always better to err on the side of caution. Don't try to tough it out or wait for it to pass. Get to a doctor or an emergency room as quickly as possible. Early diagnosis and treatment are key to preventing serious complications. Remember, your health is your most valuable asset, so don't take any chances. Now, let's shift gears and talk about chronic abdominal pain. Unlike acute pain, which is like a sudden storm, chronic pain is more like a constant drizzle. It's persistent and can wear you down over time. We're talking about pain that sticks around for weeks, months, or even longer. Imagine feeling a dull ache in your stomach for weeks on end, or experiencing recurring bouts of cramping and bloating. That's the reality for many people dealing with chronic abdominal pain. It can disrupt your daily life, affect your sleep, and even take a toll on your mental well-being. So, what causes chronic abdominal pain? It can be linked to underlying conditions like irritable bowel syndrome, IBS, chronic pancreatitis, or peptic ulcers. IBS affects the large intestine and causes symptoms like abdominal pain, cramping, bloating, gas, diarrhea, and constipation. Chronic pancreatitis is a long-term inflammation of the pancreas, causing persistent pain in the upper abdomen. Peptic ulcers are sores in the stomach lining that cause burning pain, especially on an empty stomach. Diagnosing chronic abdominal pain involves a bit of detective work. Your doctor will ask about your symptoms, medical history, and lifestyle. They may recommend tests like blood work, imaging scans, or endoscopy to get a closer look at your digestive system. The good news is that chronic abdominal pain is often manageable with the right treatment. This might involve medications, dietary changes, stress management techniques, or therapy to help you cope with the emotional toll of chronic pain. Let's talk about localized pain. Now imagine this, you're experiencing pain in your abdomen, but it's not this vague discomfort spread all over. It's pinpointed, concentrated in one specific area. That's localized pain, and it's like your body's built-in GPS system giving you a clue about which organ might be acting up. Think of it like a game of Where's Waldo, but instead of searching for a guy in a striped shirt, you're trying to figure out which organ is causing the trouble. And trust me, when it comes to your abdomen, you want to find the source of the problem as soon as possible. Now, the location of the pain can provide valuable hints. For example, pain in the upper right abdomen, just below the ribs, is often associated with problems in the gallbladder, like gallstones. Sharp pain in the lower right abdomen, specifically around the area known as McBurney's point, is a classic sign of appendicitis. Pain in the lower left abdomen can signal diverticulitis, an inflammation or infection of small pouches in the colon, and pain in the center of the abdomen, just above the belly button, could be related to pancreatitis or even a stomach ulcer. Of course, I'm just a doctor on the internet, and I can't diagnose you through a screen. But understanding the potential connections between the location of your pain and the underlying organs can be really helpful when communicating with your doctor. It allows you to provide them with more specific information about your symptoms, which can aid in a faster and more accurate diagnosis. Now let's talk about generalized pain. Unlike localized pain, which has a specific address in your abdomen, generalized pain is more like that friend who's always moving. It's all over the place. Instead of being confined to one spot, it spreads throughout your entire abdomen, making it feel like your whole stomach is saying, ouch. It's like this. Imagine your abdomen is a giant swimming pool, and instead of a single leak in one spot, the whole pool is slowly draining. That's kind of what generalized pain feels like. It's this diffuse discomfort that doesn't have a clear starting or ending point. So, what causes this widespread abdominal pain? Well, it can be triggered by a variety of factors. One common culprit is gastroenteritis, which you might know better as the stomach flu. It's usually caused by a virus and can lead to inflammation of the stomach and intestines, resulting in generalized pain, cramping, nausea, vomiting, and diarrhea. Another possible cause is intestinal obstruction, which occurs when something blocks the passage of food or stool through the intestines. This blockage can cause the intestines to swell, leading to widespread pain, bloating, and constipation. Generalized pain can also be a symptom of more serious conditions like peritonitis, an inflammation of the lining of the abdominal cavity, which can be life-threatening if left untreated. Now, I know it can be concerning when you're experiencing pain all over your abdomen. But remember, generalized pain doesn't always mean something serious is going on. Sometimes it's just your body's way of telling you that something's off, and it might resolve on its own with some rest and hydration. Let's talk about colicky pain. This type of pain is like a roller coaster ride you didn't sign up for. It comes in waves, building to an intense peak before gradually subsiding, only to return again. It's like your abdomen is playing a cruel game of hide and seek with your comfort levels. Imagine this. You're going about your day feeling perfectly fine when suddenly, bam! A sharp cramping pain hits you in the abdomen. You double over, trying to find a comfortable position, and just when you think it's past, it comes back again, even stronger than before. That, my friends, is the roller coaster of colicky pain. It's often described as a gripping or squeezing sensation, and it's typically caused by muscle contractions or spasms in the intestines or urinary tract. One of the most common culprits behind colicky pain is kidney stones. These tiny hardened deposits of minerals can form in the kidneys and travel down the ureter, the tube connecting the kidney to the bladder. As the stone moves, it irritates the ureter, causing those intense wave-like cramps. Gallstones, another type of stone that forms in the gallbladder, can also cause colicky pain, usually in the upper right abdomen. These stones can block the bile duct, causing bile to back up and irritate the gallbladder, leading to those dreaded waves of pain. Now, the good news is that colicky pain often comes and goes, and it's not always a sign of a serious medical emergency. However, if the pain is severe, persistent, or accompanied by other symptoms like fever, chills, nausea, vomiting, or blood in the urine or stool, it's essential to seek medical attention right away. Let's unravel the mystery of referred pain. This pain is a master of disguise, popping up in one part of your body when the real problem is elsewhere. It's like your body is playing a game of guess where the pain is coming from. Imagine experiencing pain in your shoulder blade without lifting anything heavy. You expect a shoulder diagnosis, but it's your gallbladder acting up. That's referred pain signals get crossed, causing discomfort in a distant location. How does this happen? It comes down to the way our nerves are wired. Nerves from different parts of the body travel along similar pathways to the brain. The brain can misinterpret signals, perceiving pain from a different location. Referred pain from abdominal organs can manifest in various ways. Pain in the right shoulder can be a sign of gallbladder disease. Pain in the left shoulder or arm can indicate a heart attack, a medical emergency. Pain in the lower back or groin can be referred from kidney problems. Understanding referred pain is crucial to identify the root cause of discomfort. Pay attention to all your symptoms and communicate them clearly to your doctor. So, there you have it. A closer look at the often confusing world of abdominal pain. We've covered a lot of ground today, from those sudden sharp pains that send you running to the ER to the lingering aches that can disrupt your daily life. Remember, your body has its own language, and pain is its way of trying to tell you something is wrong. By paying attention to the type, location, and severity of your abdominal pain, you can become a better advocate for your own health. If you're experiencing abdominal pain, don't hesitate to reach out to your doctor. They are your partners in health and can help you navigate the often complex world of diagnosis and treatment. Stay informed, stay proactive, and most importantly, take care of your amazing bodies. Understanding the type and cause of abdominal pain is crucial for effective treatment. If you experience severe or persistent pain, it's important to seek medical attention. Stay informed and take care of your health.